Could you provide insights into the intended uses and uh, prerequisites for the, I'm not sure how to say this, Dr.
Aiden,
Bonneville.
Aiden Turek,
Turek.
yeah.
Zygomatic dental implants, including the specific patient groups and surgical methods involved.
So what this caller is asking is they have a question about a specific type of implant or a specific brand of implant, I should say. Aiden Turek implant, that is what they're having questions about. For example, and I don't know where this caller is from. In the United States, some of the most popular brand of implants are Straumann, Nobel Biocare, Dentsply, or Astra, or Zimmer. These are the most popular implants in the United States, and Aiden is one of the brand of the implants. But forget about the brand, but the caller has questions about what we call it as a zygomatic implant. So what zygomatic implants mean, like the implants that you see in the front, those are the regular implants right here, and the one that goes into the cheekbone right here, so we call it as a zygoma. So the one that goes into the cheekbone, it's called the zygomatic implant right here. You see that? And the other one is right here. That's another zygomatic implant. So what those zygomatic implants are, from what I'm hearing, that someone recommended zygomatic implants for you. So again, I don't know how much of bone deterioration that you have, or what we call it as an atrophy. So when you have a lot of bone eroded away, and I don't know about your age, so if you have waited for a long time after the teeth were removed, or if you have been wearing denture for a long period of time, you almost have no bone. I'm saying like almost no bone. So you don't have bone to place any implants in the front. So in those cases, we recommend we place the implants into the jawbone or the cheekbone here, and those are called the zygomatic implants. Again, depending on whichever part of the world you are in, and they may have recommended this Aiden implant. So definitely, and if that makes sense to what I'm saying here, depending on your age and the condition of the bone and the time that you've been wearing your dentures, if they recommended the zygomatic implant, and I can definitely imagine you are a candidate for the zygomatic implants.
All right.